2015 and was being retrained, but also confirmed that recruiters had still been using it alongside other tools during the period they believed corrections were being made. The tool was eventually scrapped in 2018. Amazon stated that no recruiter decision was made solely based on the system's recommendations. The deeper structural problem is what the researchers who examined the case documented. The bias was not a malfunction, it was a perfect function. The tool learned exactly what it was taught. It learned to reproduce the demographics of past Amazon hires. If you feed a model a decade of a company's choices, it learns a decade of a company's biases. The training data is the ideology, and training data across the industry predominantly reflects a workforce that looked a particular way for a particular historical period. This is not an Amazon problem. Amazon was simply the company whose tool was exposed. The underlying architecture, train on historical data, scale to millions of decisions, is the standard model across every large technology company and most medium-sized ones conducting algorithmic resume screening. What you think of as a neutral filter is a calcified snapshot of who was hired before you were applying. You are on Facebook in the winter of 2014. You don't know it, but you are part of an experiment. Researchers from Facebook's core data science team, in collaboration with Cornell University and the University of California, San Francisco, are running what they will later describe as an emotional contagion study. For 1 week, 689,003 Facebook users have had their news feeds algorithmically manipulated. Some users see more negative posts than they would have organically. Some see more positive posts. The researchers want to know whether the emotional tone of what you consume changes the emotional tone of what you produce. The finding, published in the Proceedings of the National Academy of Sciences in June 2014, yes, users who saw more negative content produced more negative posts. Users who saw more positive content produced more positive posts. The emotional contagion was real, and it was statistically significant. You felt what the feed showed you. You expressed what you felt. You did not know the feed had been adjusted. The outrage when the paper became public was immediate and widespread, not just at the finding, but at the fact that no informed consent had been obtained. Facebook's terms of service included language about research in its data use policy, and the company maintained that users had consented when they agreed to those terms. Academics, ethicists, and the UK's Information Commissioner's Office disagreed. Cornell later stated that their researchers' involvement was limited to data analysis after the fact, not design. What was not disputed, the mechanism. The newsfeed algorithm does not show you a neutral selection of posts from people you follow. It shows you what it predicts will keep you engaged, and what keeps you engaged is, in many cases, what makes you feel something strongly. In 2017, former Facebook VP of User Growth Chamath Palihapitiya said publicly, "The short-term dopamine-driven feedback loops that we have created are destroying how society works." He had helped build the architecture he was describing. The 2014 study was not an anomaly. It was a controlled demonstration of a system that is, by design, always running. You have never seen a neutral newsfeed. You are walking down a street in Rongcheng, Shandong Province, China, in 2014. You have a score. Most people around you have a score. The score doesn't follow you digitally yet. This is the early pilot, but it exists, and it is moving. The Rongcheng Social Credit System launched in 2014 as one of approximately 80 pilot programs across China aimed at testing the mechanics of a national social credit infrastructure. The Rongcheng version worked as follows. 740,000 residents started with a baseline score of 1,000 points. Points were added for volunteering, charitable donations, and commendations from employers. Points were deducted for traffic violations, late loan repayments, jaywalking, and what the system classified as spreading misinformation online. By 2019, the national-level system, which drew on data from court records, tax filings, financial institutions, and local government databases, had been used to block citizens from purchasing flight tickets 17.5 million times and train tickets 5.5 million times, according to figures published by China's National Development and Reform Commission. A separate system tracking legal blacklists, distinct from the social credit pilot, but often reported as the same thing in Western media, covered approximately 26 million flight and train ticket denials total. The conflation of different systems is itself a documented analytical problem. Jeremy Daum, a Beijing-based lawyer and the founder of China Law Translate, has written extensively about how Western coverage has tended to present a unified, omniscient surveillance state when the actual implementation is fragmented, inconsistent, and varies enormously by city and sector. The corporate social credit system, tracking companies for regulatory compliance, is more developed than the citizen system. Most citizens in most cities are not scored in the way the Rongcheng pilot worked. What is documented and functioning, court-ordered blacklists that restrict debtors and legal violators from luxury spending, travel, and high-cost education. What is expanding? Interconnected databases that allow different government agencies to share compliance data across sectors. What the Rongcheng experiment revealed is that a population can be scored, and that scoring changes behavior before anyone tested whether the behavior changed was the behavior that needed changing. You open YouTube. You want to watch something about nutrition. 45 minutes later, you are watching a video about how the moon landing was faked. You know this happened. You may not have known there was a name for the mechanism that took you there. Guillaume Chasselot was a software engineer at Google who worked on the YouTube recommendation algorithm from 2010 to 2013. After leaving, he built a tool called Algo Transparency to map YouTube's recommendation pathways, to trace systematically where the algorithm sent viewers who started at mainstream content. In 2018, Chasselot published his findings. The recommendation engine systematically directed viewers toward progressively more extreme content. The average path from mainstream political content to conspiracy content took approximately 7 clicks. The mechanism was not ideological. The algorithm had no political position. The mechanism was engagement maximization. Extreme content tends to produce stronger emotional responses. Stronger emotional responses drive longer watch times and higher comment engagement. The algorithm was doing exactly what it was designed to do. Google disputed parts of Chasselot's methodology and said his analysis did not reflect the full picture of YouTube's recommendation system. In January 2019, YouTube announced changes to its recommendation algorithm specifically aimed at reducing the spread of content it described as borderline, videos that do not violate its policies but that are close to the line. The company stated that this change affected less than 1% of videos on the platform. A 2019 study by researchers at MIT and the University of Hamburg found that YouTube's own Up Next recommendations had led to a 70% increase in views for channels classified as far-right over the preceding 2 years. The researchers acknowledged the difficulty of establishing causality. Radicalization is not a single variable event. What the data showed was correlation, pattern, and direction. The pre-2019 architecture has been modified, but the underlying design logic, optimize for watch time, surface what produces the strongest engagement, has not been fundamentally restructured. Engagement and accuracy are different metrics, and for most of YouTube's operational history, only one of them has been directly optimized. You are 78 years old. You have just had a hip replacement. Your doctor says you need several weeks of rehabilitation at a skilled nursing facility before you can safely return home. Your insurance company has a different number. Navi Health is a care management company acquired by United Health Group in 2020. It operates a predictive algorithm called NH-Predict that is used to determine the appropriate length of post-acute care for Medicare Advantage patients, meaning people on Medicare plans offered through private insurers rather than traditional Medicare. The algorithm takes in patient data and produces a recommendation for how many days of facility-level care are medically appropriate. In November 2023, a class action lawsuit was filed in federal court alleging that United Healthcare and Navi Health were using the algorithm to systematically deny or terminate coverage for post-acute care, overriding the clinical judgment of treating physicians. The suit, brought on behalf of several families whose elderly relatives were denied coverage, alleged that the algorithm's denial rate was dramatically higher than the rate at which individual physicians were recommending continued care, and that in over 90% of cases where the algorithm denied care and an appeal was filed, the denial was reversed. The rate of reversal, the lawsuit argued, was evidence that the denials were systematically wrong. A joint investigation by Stat News and the New York Times in 2023 reviewed internal United Health documents and spoke with former Navi Health employees. Former employees described the algorithm as producing cutoff points that facilities and staff experienced as essentially non-negotiable in practice, regardless of the patient's clinical condition. One former case manager was quoted describing a system where the data tells you when the patient is going to leave, not the doctor. United Health and Navi Health denied that the algorithm was used to override physicians or deny medically necessary care. They stated the tool was used to inform care management discussions, not replace clinical decision-making. The structural issue is simple and documented. A for-profit entity acquired a tool that generates shorter care durations, applied it to the determinations of when patients leave facilities, and the patients left faster. Whether the tool was the proximate cause or a contributing factor, the direction of its influence and the direction of the profit motive were identical. You are 18 years old. It is August 2020. You have spent the last 2 years preparing for exams that were canceled because of a global pandemic. You are about to find out what your grades are, not based on what you knew, but based on a model of what someone like you probably would have scored at a school like yours given its historical performance. In the summer of 2020, the UK's Ofqual, the Office of Qualifications and Examinations Regulation, was faced with the practical problem of awarding A-level grades to 300,000-plus students who could not sit their exams. The solution? A standardization algorithm. Teachers submitted predicted grades for their students. The algorithm then adjusted those predictions based on the historical performance of each school. The consequence? 40% of teacher-predicted grades were downgraded. Students from schools with historically lower performance, statistically schools in lower-income areas, had their grades reduced far more frequently than students from high-performing schools. A student at a school that historically sent few students to university, whose teacher predicted an A, would receive a B or C. A student at a school that historically sent many students to elite universities with the same teacher prediction would be more likely to keep the A. The algorithm was not doing anything logically inconsistent. It was correcting for grade inflation, for the documented tendency of teachers to over-predict grades relative to actual exam performance. The mechanism was statistically defensible. The outcome was that a student's postcode was more predictive of their final grade than their individual performance. After days of protests, students displaying placards, universities deferring intake decisions, Scottish students receiving their results first and triggering a national debate, the UK government reversed the algorithm on August 17, 2020. All students received the higher of their teacher-predicted grade or the algorithm grade. The Secretary of State for Education, Gavin Williamson, had stated days earlier that the algorithm results would stand. He resigned 4 months later. 250,000 students in England received incorrect grades that were on their official records for a period before the reversal. Several university offers were rescinded and then reinstated in the confusion. The students who were most affected by the algorithm were the ones who had the least institutional power to appeal it. It is 1:47 a.m. You are outside a venue. You need a car. You open Uber and see the surge multiplier. You accept it immediately. Uber's surge pricing system is well documented. When demand exceeds supply in a given area, prices increase algorithmically to both incentivize more drivers to enter the area and to reduce demand by pricing out some riders. Uber has been transparent about this mechanism for years. What is less transparent is what variables the algorithm monitors about you. Keith Chen, then the head of economic research at Uber, gave an interview to NPR's Hidden Brain in 2016, in which he discussed behavioral economics research Uber had conducted into surge pricing acceptance. Among the variables studied, battery life. Chen confirmed that Uber had run analysis on whether users with low phone batteries were more likely to accept surge pricing. The finding was yes. Users under stress, low battery correlating with being stranded or anxious, accepted higher prices at higher rates. In the same interview, Chen stated explicitly that Uber did not use battery status as an input into its surge pricing algorithm, that the research was conducted but not operationalized. He framed it as an ethical decision the company had made. Uber has not released the complete list of variables its pricing model uses. The structural situation this creates, you are using an application run by a company that has access to your battery percentage, your location history, your time patterns, your previous surge acceptance rates, and dozens of other behavioral signals. The company has confirmed it researches the correlation between some of these signals and price acceptance. The company asserts it does not use this data for pricing. There is no independent third-party audit of that assertion. Surge pricing itself is not deceptive. It is disclosed at the point of purchase. The question this case surfaces is a different one. When you use a service that continuously monitors your state of need, and that service has a direct financial interest in matching price to the peak of your desperation, the appropriate question is not whether you were informed. The appropriate question is what it means to freely consent to a price when the algorithm knows more about your current level of need than you've consciously registered. You are 22 years old. You have never missed a payment on anything. You have never defaulted on anything. You have never borrowed anything. You apply for your first credit card, you are denied. In 2015, the Consumer Financial Protection Bureau published a report titled Data Point: Credit Invisibles. Its finding, 45 million Americans had no credit score at all. Not a low score, no score. The credit reporting agencies, Experian, Equifax, TransUnion, had no scorable information on them. An additional 8 million had credit files so thin or so inactive that they could not generate a score. The CFPB's demographic breakdown of who comprised the credit invisible, disproportionately young adults, lower-income individuals, Black Americans, Hispanic Americans, and residents of rural communities. The mechanism producing this disparity is structural. Credit scores are generated from credit history, and credit history is generated from credit products, credit cards, auto loans, mortgages. If your family historically did not use formal banking infrastructure, if you arrived in the country recently, if you live in a community where the formal credit economy is less integrated into daily transactions, you do not accumulate credit history. You remain invisible. Credit invisibility is not a passive state, it is an active barrier. The CFPB documented that credit-invisible individuals face catch-22 barriers across housing, employment, and access to capital. Many employers run credit checks as part of hiring. Many landlords require credit scores for rental applications. Most business loans require credit history. The system that assigns creditworthiness requires creditworthiness to enter. Several fintech companies have attempted to address credit invisibility by incorporating alternative data, rent payments, utility payments, bank account history, into scoring models. The three major credit bureaus have developed alternative scoring models as well. As of 2023, Fannie Mae and Freddie Mac began accepting FICO Score 10T and Vantage Score 4.0, which incorporate rental payment history. The pace of adoption remains slower than the scale of the problem. The 45 million Americans who are credit invisible are not financially irresponsible. They are financially undocumented in the specific format that the algorithm recognizes. The algorithm does not see who they are. It sees the absence of a record it was designed to read. You are a patrol officer in Los Angeles in 2012. Before your shift, a software system called Predpol tells you which 500-square-foot boxes on a map of the city are statistically most likely to have crime during your shift. You drive toward those boxes. Predpol was developed by researchers at UCLA, criminologist P. Jeffrey Brantingham, and mathematician George Moeller, using an algorithm originally developed to predict earthquake aftershocks. The underlying logic is that crime, like seismic activity, tends to cluster. One crime in an area makes subsequent crimes in that area more likely in the short term. The algorithm takes historical crime data and generates probability distributions for future crime locations. By 2013, Predpol was in use in the LAPD and approximately 60 other departments across the United States. In 2020, the RAND Corporation published an evaluation of predictive policing systems, including Predpol. The finding on feedback loops, departments using predictive policing tended to direct officers toward neighborhoods that had historically high crime rates, which were, disproportionately, lower-income neighborhoods and neighborhoods of color. Increased police presence in those areas produced more arrests, which fed back into the historical data, which made those areas appear in the model as even higher risk, which sent more officers there. The algorithm was a self-reinforcing loop whose input and output were the same pattern. The technical term for this is dirty data feedback, when the historical crime data reflects the patterns of prior policing rather than the patterns of actual crime, and when that data is used to generate future policing strategy, the model amplifies the original disparity. Crime that was never reported, white-collar crime, crime in well-policed but not heavily patrolled areas, does not appear in the data and therefore does not generate predictions. Santa Cruz, California became the first U.S. city to ban predictive policing technology in June 2020. Los Angeles ceased using Predpol, by then renamed GeoLishka, in 2020 after the Los Angeles Police Commission found that the department could not demonstrate the technology's effectiveness and that it raised civil rights concerns. A subsequent investigation by the Los Angeles Times found that the program had been deployed disproportionately in Black and Latino neighborhoods. Predpol did not create racial disparities in American policing. It inherited them, encoded them, and amplified them at scale. The same historical data that the algorithm trained on was the same history that produced the disparities the algorithm then reproduced. The machine learned from the world that built it.